Hi, how are you?
Good, thanks. How are you?
Excellent. It's all good. What is the website? Is there a website for this interview?
Yes, there's actually two websites. You can get direct information on the Vaccines for Children's program from the CDC website, which is www.cdc.gov. And we'd also like folks to know that they can get information. They can find out what their local health department is in their community by visiting www.nacho.org. That's NACCHO.org/widget. And there they can just plug in their zip code and will pop up information about their local health department.
NACCO slash
NACCHO.org/widget. WIDGET.
Okay, we'll mention that as well.
That's great.
And is there an email just to get back to you with as well? For a thank you note?
Yeah, let me give you our public information officer.
Okay.
Her name is Rita Obey, and her email is robey@hcphes.org. That's basically Harris County Public Health and Environmental Services, so hcphes.org.
Okay. And how do I pronounce your first name?
Herminia.
Here we go. Hi, it's Paul Slatkis, Good News Broadcast, speaking to Dr. Herminia Palacio. Hi, how are you?
I'm doing well, thanks. How are you this morning?
Okay, good. Did I pronounce your last name okay and your first name or no?
You did great, thanks.
Yay! And it's good to be to say the right thing, because our names are, of course, very important, and the health of our children is very important. We're going to talk about making sure that your children are healthy, and you're the executive director of Harris County, that's in Texas, Public Health and Environmental Sciences, and we're going to talk about vaccines. And many parents are unaware of no or low-cost childhood vaccines during economic downturn. Okay, so I imagine that's so. So where can somebody get one that's more economically feasible for themselves?
Well, I'm glad you asked. As you know, it's back-to-school time across the nation. This is a time when many parents are getting those little notes from school saying, this is what your child is required to have. And in this economic situation, it can be a struggle for parents to meet these requirements. But there is a federal program we wanted to make sure everybody was aware of. It's called Vaccines for Children. And through this program, parents who are eligible can receive either free or low-cost vaccines for their children up through ages of 18 years old. So it really provides not just those infant vaccines people are used to getting and the toddler vaccines, but also the very many vaccines that are recommended for adolescents and for college freshmen.
Wow. Okay. So tell us about this campaign. I'll even call it. Who's behind it, and what are some of the details on actually doing this?
Sure. Well, we're here today on behalf of the National Association of County and City Health Officials. That is an organization that represents the nearly 3,000 local health departments that are trying to keep their communities healthy day in and day out. So this is our national organization, and we feel it's so important to make sure that our children are protected, that our families are protected from these diseases that people don't think about every day, but these are diseases that are still circulating in our community. For example, there are several whooping cough outbreaks right now across the nation. This is a disease that can still be very deadly, especially to infants and folks who are older. And we have a very easy way to prevent this, which is getting shots. So we want to make sure that folks, number one, are aware of the vaccines that are recommended for their children, and number two, are aware that if they're struggling economically, that there's help, that this is so important that we're trying to provide ways to find, that the federal government and states are really trying to find ways to help parents be able to afford these vaccines. We know parents want to do everything they can to keep their children healthy and to keep their children safe.
Okay, so I went to a website, NACCHO.org, right?
Correct.
and then I put in my zip code, and then it gave me local health departments near my zip code, right? And
Right.
so then do I contact that local health department?
Absolutely. If you call your local health department will be able to tell you what vaccines are required in your state. They'll be able to tell you where you can get low-cost or no-cost vaccines through, including through the Vaccines for Children's programs in your community. There are many physicians, pediatricians, clinics, offices, and local health departments that all participate in the Vaccines for Children's program. So really, we want parents to know that there are wide options in their community. They don't have to go to a single place. The Vaccines for Children program is available to folks who either don't have any insurance, or it's even available to folks who do have insurance, but maybe that insurance doesn't cover the cost of vaccines. It may be that you have Medicaid or you have CHIP. It may be that you don't have documents for your legal status in this country. All of those people are still eligible to participate in the Vaccines for Children's program, because really there's nothing more important than protecting our children and protecting our communities. When teenagers get vaccinated against pertussis, they're not just protecting themselves, they're protecting their classmates. They may be protecting grandma and grandpa. They may be protecting a little baby sister at home who's not old enough to get vaccines. So this is really an important way to keep yourself safe and to keep your family safe, your community safe.
Okay, I agree with you, and the parents should be definitely considering this as well for themselves.
Absolutely.
Because there's no, reality. There's the reality that they could, in essence, get their own children. Because these kinds of reasoning for getting vaccinated is that these are contagious. Isn't that so?
Very contagious and can be very serious diseases. Some of them can result in long-term health consequences. Some of them can sadly result in death. Some of them really, parents, families can be devastated by having one of these diseases affect their children.
What kind of a doctor, MD, are you?
I am an internist.
Okay.
I'm an adult doctor.
And with regard to, say, the children, what are some of the types of vaccines that children should consider?
Well, for little kids, we're really talking about beginning their series for things like diphtheria and polio and some of the early types of meningitis that kids can get when they're little. For adolescents, we're really looking at making sure that adolescents are getting their tetanus boosters or getting their pertussis boosters, or making sure that they're protected against chickenpox. And we also want to make sure that adolescents are getting the very important vaccines, the new vaccines available against meningitis. One of the things that people don't know is that the populations that's at greatest risk of getting meningitis, actually, one of the populations is college freshmen. So we want to make sure that our adolescents get vaccine before they go off to these very important episodes in their lives at college.
Yeah, there's no doubt about it, and even those that are older. I know at one point, though, we had a crisis, I believe, in the country where they ran out of vaccinations. Isn't that so?
Well, from time to time, you're absolutely right that there may be a particular vaccine where the manufacturer is having a hard time keep up with the supply. And again, if folks go to that website at www.nacshow.org/widget and find out where their local health department is, their local health department will be able to tell them if there are any particular shortages in their communities that they might need to be aware of.
Okay, last question for you, Doctor. What's good news for you?
Good news for me is that you have invited me to participate in this program, and really that we've had a chance to have this wonderful conversation, because there's so many parents out there that are looking to be able to protect their kids, and that we think the Vaccines for Children's program is just one more tool they can use to help them provide for their families.
And obviously, I'll just add, because you're a caring organization, National Association of County and City Health Officials, association representing 2,800 local health departments across the country. That's great.
Thank you very much.